Good evening, everybody. Hello, and thank you for joining us this evening for our special education and distance learning webinar series. Tonight, we're going to learn about navigating distance learning during COVID-19. And we're so happy that all of you can be with us this evening. TASC is partnering with the Epilepsy Foundation this evening to provide this webinar. And so we're so pleased to be partnering with them and appreciate their partnership and their collaboration so much. We'll be hearing from Rebecca Halliwell, who is the Executive Director of the Epilepsy Foundation of Greater Los Angeles, in just a few minutes, and she'll be sharing the great services that the Epilepsy Foundation provides. We also have Shannon Abdul Wahab with us this evening, and she's the Executive Director of the Epilepsy Foundation in Orange County. And so both of them will also be helping to read out questions that are in chat, as well as providing a presentation on the services that they offer. And I'd like to thank Anna Kim, who is one of our family support specialists, and she's the host this evening, letting everybody in, and she'll be sharing some documents with you through chat in just a little bit. So my name is Paula West Hernandez. I'm a project manager at TASC, and I will be co-presenting this evening with my colleague Susie Villalobos, who is a family support specialist with TASC. And we're pleased to be working and presenting this webinar to you this evening. So before we get started, we'd like to share a few details that will help our webinar go a little bit more smoothly. So we've muted everybody's mics, and we've also turned off video for this webinar. If you have questions that you'd like to ask, please put them in chat, and either Anna, Rebecca, or Shannon will read the questions to Susie or me as you ask them. So you don't need to wait for a certain time as the question comes to your mind. And if it's topic related, please feel free to go ahead and put that in chat, and one of those ladies will read the question to the presenters. Also, too, Anna will be sharing our handouts this evening. We have the PowerPoint handout in PDF format, and we also have a resource list that we'd like to hand out to everybody who's here this evening. And so Anna will be providing those to you in chat. Now, if for some reason you're not able to if you're not able to access those through chat, then you can email us and we'll send you those documents after the webinar. And most likely it won't be before tomorrow, but we will get those documents to you. So you can email us at task@taskca.org. That's task@taskca.org. And Anna's going to put that in chat so that you'll see that. Email us and just please give us your full name, your email, and the county that you're from, and we will email you a copy of the handouts from tonight's presentation. So this webinar is being recorded. So if for some reason one of your friends, your relatives, your family, I already said relatives, are not able to be with you this evening, and you'd like them to be able to see this webinar, if you want to go back and review it, please let them know that we are recording and it's available. If you visit our website, it's www.taskca.org. Go to workshop schedules, and then there's a link there to our YouTube page, and you'll be able to listen to the recording from there. So again, we're so happy that you've all joined us this evening. And right now, I'd like to turn it over to Rebecca Halliwell. And she's going to share with us some information about the Epilepsy Foundation. Rebecca?
Thank you so much, Paula. Thank you, Susie, for pulling up the slides. If you can go to that third slide, and we'll start at that third one. There we go. So the Epilepsy Foundation, we have been around for more than 60 years. We're a nationwide organization. We're really pleased to be partnering locally with TASC. Like Paula introduced, I'm Rebecca from the Epilepsy Foundation Greater Los Angeles, and Shannon Abdul Wahab, Epilepsy Foundation Orange County. So we've been leading the fight to overcome the challenges of living with epilepsy and to accelerate therapies to stop seizures, find cures, and save lives. we're about ending epilepsy. And we're doing that together by providing programs and services that support individuals with epilepsy and the entire family as well. We have two amazing events coming up: our Care and Cure Benefit, September 16th and September 26th, all virtual, as I'm sure you all would assume. And we have our Walk to End Epilepsy in November. So the Care and Cure Benefit, it's a beautiful event that actually supports and funds pediatric fellows and specialists. There's an unfortunate lack of epileptologists. And so that benefit has provided, we've had more than 30 specialists in the Southern California area because of that benefit. And then our Walk to End Epilepsy is similar to other walks I'm sure you've heard. And it's about really rallying the community together to speak up about epilepsy and raise awareness to end epilepsy. Next slide, Susie. And Amy, I see your question, and this webinar tonight is applicable to everyone, not just those with epilepsy. So here's a rundown just of kind of our programs and services. We do quite a bit, no matter where you are on the journey of epilepsy. We are there to support you. We have support groups, self-management groups. We do a lot of state advocacy, federal advocacy. We have art therapy programs, educational opportunities to educate the general public as well as the community affected by seizures. We have a kids crew program where that's really empowering children with epilepsy as well as their siblings or friends to get involved in the cause. And we have a lot of fun social events too. Again, right now everything's virtual, but we've been having a really great time. Comedy nights, so much more. And we really would love for you all to get involved. Again, we provide support for people with seizures and epilepsy. Next slide, please. And here's our contact information. Best way to get to us is epilepsyevents.org or epilepsyeventsoc.org. And thank you, TASC, so much again for partnering with us. And we're so pleased to be here. And thank you all so much for joining as well.
Thank you, Rebecca. So I'd like to tell you a little bit about TASC now. We're a family empowerment center and a parent training and information center. And we're funded by the U.S. Department of Education Office for Special Education Programs and also the California Department of Education. And the departments of federal and state departments of education provide grants to us so that we can work with families who have children with disabilities to help them understand the special education system, to navigate it, and to work with schools so that their children can receive an appropriate education. We're going to talk a little bit in just a few slides about how we do that. But one of the main things that we do is we work with schools and parents and help facilitate or help them to be able to communicate effectively and to keep a bridge of communication open for communication and collaboration. We serve 6 counties in Southern California: Ventura, Los Angeles, Riverside, Orange, San Diego, and Imperial counties. And we have offices in Alhambra, Riverside, Brea, which is in Orange County, and Spring Valley, which is in San Diego County. Next slide. So TASC educates and empowers people with disabilities and their families. And we work with the families and the parents because we believe that they are the best advocates for their children. They understand their children, they love their children. And you know, I know when they held that little tiny person in their arms for the first time, their heartstrings were just wrapped right around that little one, and nothing can separate them from that. So the parents are the advocates for their children, and we provide support and information to help the parents to gain information so that they can speak up for their children. Next slide. So we want you to know that TASC does not have advocates, and we do not have attorneys. We're family support specialists. And most of us are either have a disability ourselves, or are parents of children with disabilities, or the relative of someone with a disability, or maybe we fit multiple categories. So we have walked in similar shoes to the ones that many parents that contact us are walking in. And so because of that, we're able to understand some of the concerns that families are facing. We don't provide recommendations or we don't provide suggestions, but what we do provide is support and understanding and information. So when a parent comes to us, and we can help them get started with the special education process and walk them all the way through. And we've actually seen some of our kids go from kindergarten all the way up through and graduate from 12th grade. So I apologize if you hear barking, that is my little guys. And if I mute, then we can't hear anything. So anyway, they're joining us this evening. Okay, next slide. Okay, so these are the family support services. All of the family support services are free of charge, and there isn't a limit to the number of services that you can ask for from us. So people can call us and we can provide telephone consultation. They can, if you'll be speaking initially with the receptionist, and then once she takes an intake, then a family support specialist will call you back, and you can speak with that person, talk to them about your concerns, and if you and they feel that you would like that an IEP consultation would be helpful so that they can review your IEP documents, your individualized education plan documents, your assessment reports, maybe a letter that you received or a letter that you've written and you'd like someone to review it. Then during that consultation, the family support specialist will be able to meet with you one-on-one and go over those documents with you and help you to understand your options within the federal and state special education laws, and also based on what they're seeing in the document. Again, we cannot interpret reports and we cannot provide legal advice, but we will provide support and the options that we see based on the documents that we're reviewing. And of course, we would ask you to sign release forms giving us permission to view your documents. We also provide 2 parent support groups. One is Restorative Connection, and that's provided the 2nd and 4th Wednesdays of the month. That's facilitated by a licensed marriage family therapist, and she gives guided conversation and topic discussion on a lot of different emotional experiences that families are having, in particular right now related to school closures, distance learning, just the whole COVID-19 and how life has changed, or any other topic that might impact emotion. And then Parent Connection is a group that meets on Tuesday, the 4th Tuesday of every month. That's a group where it's led by peers, and we get together and talk with other parents who have children with disabilities that are going through the special education process. And we share together ideas, thoughts, concerns, and we put together a resource list during our conversation that participants can take home with them. All those, both groups are confidential and the meetings are not recorded. So we'd love for you to join us for those groups as well. And then we also offer webinars and outreach into the community. Okay, next slide. So the tech services, we have a terrific tech center at Task in addition to our FSS support. And the technology department provides assistive technology labs where families and professionals can meet with a tech specialist and the student. So we need the student there, and they will go over different apps or different assistive technology devices to see what might work best for the student. They also offer Tech Connection, which is a social and life skills building group for teens 15 and older. I think our oldest participant is 30 now. So we have anywhere from 15 to 30 in that group. And they use different assistive technology devices for communication, as well as just building on their social skills and their life skills. And they either will participate with a parent or a applied behavior analysis provider. And so that's a great group that is very, very popular with our tech department. And then, yes.
Paula, we had a question. Are the tech labs currently open for students in person?
Not in person, but they are. Okay, can you hear me now? Okay, so I'm not sure how much you heard. So the tech labs are open, but we're doing them through Zoom. So all of task services right now are being provided remotely, but just like our IEP consultations are done through Zoom, the tech labs are also offered through Zoom. So yeah, our Camp Techie has been closed during school closures or during COVID-19, so because our offices are closed. But we hope to have that open next summer. We hope that we're all back in our offices by then. So Tech Connection is a group that our technology department provides. It's a camp that's offered in the summer for 1 day a week for 2 hours. And kids 5 through 12 come with their parents and learn to use assistive technology to have fun and learn to communicate and interact with each other, as well as just to explore the world around them. So that's a really great group as well. Okay.
Paula,
yes.
One more question. How can folks set up an appointment? So
for either the technology department or the family sports specialist, you can call our main number, which is 714-533-8275. And then you can let the receptionist know whether you want to speak with a family support specialist. You give them your information, and then she'll connect. She will send a message to whichever family support specialist is available, and you'll get a call back from them, or the tech department, and then the tech department will call you back.
Great. And I'm on a roll, Paula, so I've got one more question, and you can tell me if
sure.
you'll take one in a second. Are there any special education services available in SoCal in person currently?
That, in terms of special education services, can you clarify that? I'm not, in terms of task?
Not quite sure. Colleen, maybe if you can expand upon that, and then maybe I can.
Yeah, and then I'd be happy to
pass it along.
That. Yeah. Okay, so I'll go ahead and move along, and then Rebecca, when you see the clarification, then I'd be happy to stop and answer that.
Colleen is saying she can't unmute herself, but we'll find you. Yeah, we'll come back, and Colleen, if you wouldn't mind just maybe putting it in the chat, that would be great for the time being.
Okay, wonderful. Thank you, Shannon. Okay, so slide, let's see. Okay, so next slide. So here's some of our upcoming events. You can read those for yourself. I won't necessarily go through and read all of those for you right now, but you can see that we do have 2 more events coming up in this series, and we'd love for you to join us on the 20th and the 27th for our the next events in this series: regression and distance learning, and also special education and distance learning, recovery services, and compensatory education. So we are going to talk about some of those topics in the next couple of weeks. Okay, next slide. Here's our website, and again, our mission statement. Next slide. So again, you guys are going to have this memorized by the time you leave here this evening. We want to welcome you to the second webinar in the Special Education and Distance Learning series. And tonight we're going to learn about navigating distance learning during COVID-19.
Paula,
yes.
I'm going to interrupt you again. Apologies.
Sure.
So Colleen did expand, and it's social groups, speech services, OT. Are any of those available? And then the second question also was, is this relevant just for the webinar today for Southern California, or is it elsewhere throughout the state as well?
Okay, so this webinar is relevant throughout California. And okay, so that's the second part. And then the first part is many places are offering services virtually. There may be some that are offering directly, if you know, and we're going to talk a little bit about how that can be done through school districts. But for now, I can't answer that question in terms of other people, but I know that we have a speech pathologist that we contract with, and she's doing everything virtually at this point. So I can't speak for all of the therapists in California. But if you visit California Yellow Pages for Kids with Disabilities, it's through Rights Law, and they have a whole listing of speech therapists, and they give the location that they're in. You can look at there and then maybe contact the individual therapist to see how they might be providing services.
Okay, and then lastly, there is a slight, like the little yellow box with some writing in it on the screen, and I'm not sure if we can remove it, but I know everybody can see it. We can still read what's there. It's okay, not.
Are they the presenter notes?
I don't know what they are. No? Actually, I can't tell what it is. But anyway, I just wanted to note that it's there and we see it.
Okay.
Listen mostly to Paula, everyone, and we'll continue to work on it.
That's right.
I'm sorry, I'm not able to remove it for some reason.
Oh, okay. Okay. Well,
it's not allowing me to do it. That's why the slides keep changing, because I'm trying to remove it and it won't allow me to.
Okay. Well, don't worry about it. Moving forward then. Let's have a great rest of our presentation.
I apologize for that.
No problem, Susie. And just so you know, I'm reading Braille, so I know it's not me. Okay, but anyway, and on that note, so sometimes, so I'm blind, and I'm one of the staff members at Task who fills multiple categories. I am blind, and I also have, I have 3 children, but my oldest one does have a disability as well. So I've navigated special ed as a parent and as a student. But anyway, and there will be times this evening where my brain, my mouth, and my fingers all run at different speeds. So there may be a time where I need to let one or the other catch up with the other group. So if you hear me pause, that's what's happening. All right, so let's go ahead down to the next slide. And this is what we're going to learn tonight during this webinar. So we're going to talk about special education during distance learning. We're going to talk about 2 new laws that are California laws only. They're not federal laws, but California laws that impact special education during school closures. And then these laws impact the instructional minutes on a daily basis that students will receive, the IEP and emergency plans, and special education timelines. And then we're also going to talk this evening about what will education look like when students return to school during the 2021 school year. Okay, next slide. Here's an acronym slide, and this slide provides the acronyms that we'll be using this evening and that you may see in your individualized education program meetings or in the documents that you receive. So for this evening, you can refer back to this if you're not sure about the acronyms that we're using. I will do my very best, and I know Susie will as well, to always explain an acronym the first time we use it. After that, we may just go ahead and use the acronym because it's quite a mouthful with some of them. But if we don't do that, if we don't explain what an acronym is, or you didn't catch it the first time round, please let us know and we will stop and make sure that we spell that acronym out so you know what we're talking about. Okay, next slide. So, special education during distance learning. It's so important for schools and families to communicate together openly, honestly, and constantly. We need regular communication between schools and district and parents. And we know that these are challenging times for school districts and for parents. We know that districts are working very, very hard to provide education, to be able to provide it in a format that teachers have not been used to using, and either providing it from their homes or providing it from campus, and trying to manage virtual instruction. And so we appreciate all of the effort that districts are going through to make sure that our children receive an education. And in terms of the parents, we know how difficult this process has also been for you as you're trying to juggle work and coaching your children at home during distance learning, and all of the other things that you are going through as you navigate COVID-19. So especially, when times are tough, that's the time to really work together and pull together as a united team. And that is what we're living in today, is a time where we need to pull together and help our children. Communication is always important, but in this day and time, it's even more important than ever. So we encourage districts and families, please reach out to each other. Don't be afraid to initiate conversation with each other, and don't be afraid to respectfully bring up any concerns that you may have, whether it's with a student not turning in homework, or a parent not being able to access the platforms, or a student not being able to access platforms, whatever it may be. Keep that conversation open, because we know that everybody is doing their very, very best at this time to be able to manage and adapt and learn new ways of doing things. So right now, if in the general education population are being provided with an education, which we know they are, then students who receive or who have individualized education programs, or IEP meetings, or IEP documents, students who have those documents or a Section 504 plan, they need to have access to education, and they need to receive a free, appropriate public education that is in accordance with their IEP or their Section 504 plan. Now, the services need to be provided that are written in the plan, but the way that they're provided may look different during this time. And I can pretty much guarantee that they are going to look different during this time, because we're doing things remotely. There are some occasions where the parent and the school have agreed that it is safe if safety and health measures are followed, and also social distancing guidelines for direct service to be provided in limited cases. But again, that's a case-by-case decision. But for the most part, related services like speech, occupational therapy, physical therapy, those types of things, assistive technology, are all being offered virtually. They may be offered by telephone. They can be offered on virtual platforms, maybe that can be accessed through tablets, Google Chrome books, or laptops. So there's just a lot of different ways that instruction can be provided right now. The services, having said that, I know that service providers are getting creative in the way that they're offering services, but this is where communication is essential between home and school, because the school doesn't know if that service provision is working for your child if they don't hear anything from you. So if your child doesn't want to participate in the method of instruction or in the method of related service provision that's being offered, but the school doesn't know about it, then they can't really work with you, with parents, to try to remedy that situation. And then, so that's why communicating with the school to let them know what is working and what is not working for the student is crucial. So,
Paula, we have a few questions. If
sure.
now's a good time to interrupt. Okay.
Sure.
So Francisca's asking, her son has a one-on-one. How will services be provided during distance learning?
That's a really good question, Francesca, and we're going to be talking about that. So with your permission, I'm going to go ahead and I'll talk about that when we get to the slides. And actually, I have a bullet point in just a couple of seconds, so we will be there soon. Yes.
Did you want me to address a couple other questions I have here, Paula? Okay.
Yes.
So Amy is saying that Zoom doesn't work for her child. Is there any resources available to have someone come in person for her one-on-one time with her special ed teacher?
Right now, if you want to get, if you want to change, okay, let me start over. So right now, the services that are in the child's IEP need to be provided to the student, albeit they may be provided in a different modality than you had when you were in school. Okay, so having said that, if you want to add a service that the school, such as one-on-one aid or something that is difficult to provide through direct service, and you want to contract, let's say, with a non-public agency to provide that, that would be something that you would need to talk to have an IEP meeting with the rest of your district members of the team and talk with them to see if they would be willing to fund a non-public agency perhaps to come in and provide a one-on-one aid so that your student can access educational benefit, because that would be a change in service and so that's an IEP decision that would need to be made by the team. But before you get to that point, before you go into maybe that, talk with the teacher and talk with your IEP team just informally and see if there's a solution that you can come up with to provide some kind of support that will help your child. And then if need be, then request an IEP meeting so that you can discuss perhaps working with a non-public agency.
And Paula, how do you calculate special ed hours on the IEP to virtual learning?
How do you calculate? That I don't have an answer for that question. That's a good question. That's a very good question. I'm not, the only thing I can say is contact your director of special education or contact maybe a psychologist at your school or one of your IEP team members and ask them. I think they might have a better answer than I do, which is I don't know. So.
And then last one, and then I'll let you continue for now anyway. So there are some tutors that are willing to teach kiddos one-on-one. Is it possible to request the school to pay for those fees? And I sure as heck we can. Yes.
Yeah. So it is possible. Okay. But again, because tutoring, if tutoring is written into your IEP already, and the IEP already provides for you, for the district to fund an outside tutor, then that's already going to be provided for. But if that hasn't been written into your IEP, and tutoring services are not a service in your IEP, then you would need to meet as a team to discuss funding a tutor. And if you go ahead and fund a tutor, and then go to the school and ask them to reimburse you, you would need to give the district a 10-day notice before you would actually start working with that tutor. You give them that 10-day notice that you're hiring or funding a private tutor and that you're going to be requesting reimbursement, but that's not going to be automatic. You're not going to get automatic reimbursement. You're going to need to work with the school district, and if they agree, great, but they may not agree. And if they don't agree, then you may need to go through the appeals process. Okay, shall I move on? Any other questions?
That wraps it up for now. I'm sure there's going to be more.
Thanks, Rebecca. All right. So, Francesca, I hope this answers a little bit of your question about how services might be delivered. So they can be delivered by phone. They can be delivered virtually through Zoom. Google Classroom, I think, is another platform. I know there's other platforms out there. They may be offered in some cases, like I said, through very small groups or one-on-one direct service. But again, that would be an individual decision for the parents in the school and the IEP team. And of course, making sure that social distancing guidelines and health and safety guidelines are in place to keep everyone safe and healthy. they could be offered, if they are direct, maybe in the home or in a different location, depending on what the parents and the school feels comfortable with. And of course, the student would need a location where they can access benefit from that service as well. My brain and fingers are trying to catch up, so bear with me just a minute, please. Okay, so also students are going to need, some students already have assistive technology written into their IEPs, and other students may need to have assistive technology provided to them so that they can access their education at this time. And so these are some of the things that the IEP team needs to work out. If assistive technology wasn't necessary while kids were in school, but it is now, then how is that going to be delivered, and what kind of devices or apps will be provided? Also, too, sometimes just by, I know I use VoiceOver on my phone, and that's a great assistive technology that comes with my iPhone. So sometimes there's technology that's built into the devices that we can use at home as well. And so, like I said, telephone instruction is also being offered right now. Sometimes we may need to have accommodations during distance learning. And so, kids may need to have frequent breaks from being in front of the screen so much. I know that kids with health conditions, maybe with epilepsy or other neurological medical conditions, their health is impacted by spending a lot of time in front of a monitor. Or it can become very stressful for some people. And so some students may need to have frequent breaks. They may need to have longer time to do their assignments, or they may need to have fewer questions. They may need to have their assignments reduced. Also, too, maybe for students who have reading disabilities or who have a visual impairment or are blind, they may need alternate formats for printed material. And we may need some kind of sign language embedded or provided for children who are deaf or who have hearing loss. So there's all kinds of things that we need to think about while providing education for students in distance learning. Okay.
Would now be a good time, Paula, to address a couple questions?
Sure.
Okay. All right, let me just jump up here. So Stacy mentions that she's a provider and she works with youth that have intense mental health issues. Many of them have IEPs where the youth supports have not been offered since SIP. Is the solution to request an IEP meeting to address the lack of services?
Yes, so if the services are actually written in the IEP document, then writing a letter to the district, and right now they're very, very busy, and I know they're trying to do as much as they can, but sometimes, our kiddos are not getting the services they need. So if you write to the district, write to your IEP team, and let them know what your IEP provides, and that these services have not been provided to your student, then we give the school district a chance, or the school a chance, to remedy the situation. If the services are not written into the IEP and you would like them written into the IEP, that's when you would call a meeting to discuss adding services to the IEP. And then that may necessitate having an assessment completed. And that's another story that another thing that we're going to talk about in just a little bit, how assessments have been impacted during COVID-19. So, but those are a couple of things that, it really depends if the service is already in your IEP, or if you want to get something written into your IEP, how you would manage that.
And the second question from Carla, her son just started middle school, and most of his goals are social and behavioral, self-regulating. What can Carla request at the IEP to help meet his goals if counseling services are done one-on-one via Zoom?
Perhaps there's a small, I don't know how they're doing social skills training. I don't know, that's more of a social pragmatics, a type of group, but maybe there's a small group that promotes social interaction, maybe a small group of students that are, working in small group for counseling through Zoom or another virtual platform. Those might be some options. Some other options might be, and I know my son has mental health concerns as well. And so I'm working with an outside group. And I call different hospitals, also different groups like Child Guidance Center and other groups. NAMI is wonderful with providing mental health services as well, and it's NAMI. So you can contact groups like that, and they have peer-to-peer support groups, and they also have support groups for parents and relatives so that you can understand mental health concerns better. They have a 12-week program that you can go through. I've been through it and it's wonderful. It was so helpful. And my son also participated in a peer-to-peer group. And then he's also now currently involved in a group for people who are dealing with mental health issues that are just being impacted heavily by this COVID-19 and shelter in place. So I would encourage you to maybe in addition to seeking out, and exploring what can be done through the IEP team, look at other private options through your insurance or even through NAMI. That's a free service that you can access and get support, and also some social interaction for your child. Okay, let's go to the next slide. Okay, so what about IEP meetings during school closures? Do they have to be held? And yes, they do. So IEP meetings need to be held annually, and every 3 years we need to have a triennial where we reassess and determine if the child continues to require special education services. But either the district members of the team or the parent members of the team can request IEP meetings anytime they feel that significant regression is taking place, they feel the need for more service, they feel that goals need to be modified, placement needs to be discussed, although right now we're doing distance learning. So, but anytime any of those things are in question, either the district or the parent members of the team can request an IEP meeting, and one should be scheduled. Now, IEP teams don't need to meet in person. They can meet virtually or through telephone conferencing. If you already have IEP services in place, but you want to propose the addition of some accommodations or maybe a modification to a service, then if the parent and district members of the IEP team agree, then an addendum document can be written and it will become part of the IEP. The parent can request a copy of that addendum, and then that addendum will then be implemented to provide the services or the accommodations that the parent or district wants to be included. So that's one way that the IEP document can be amended without the team having to meet. But if the team does meet, it can meet virtually. Is there a question?
No. Paulo, yes, we do have a question. So Adriana had an evaluation for her son. It sounds like she was going to have that IEP meeting to discuss that outcome of the evaluation about a week following shelter in place. She's reached out to them. They're really unclear about what the next steps are. So how are timelines being honored? Because there were the 60 days and she has no follow-up. Is what I'm understanding.
Okay, so the 60-day timeline has not been impacted by the changes to the California law. And so if an assessment was completed, then an IEP team should have been scheduled within the 60 days. And if that hasn't happened, then please reach out to, it sounds like you've already reached out to your IEP team. So the next step would be to reach out to the Director of Special Education for the district. And if that doesn't if that doesn't resolve the situation, reach out to the Director of the SELPA the SELPA, that stands for Special Education Local Plan Area, and try to get them involved with getting an IEP meeting in place so that you can discuss the results and discuss the services that may need to be written into the IEP, as provided in the assessment report, through the outcome of the assessment report. So at that time, we're going to talk, I'm not going to go into compliance things right now because that has been impacted, that has been changed by one of the California laws that has been passed. But I would say just go up the chain of command through your district and work within each level, because we really want to give the local level first, the school, the people involved at the school level, and then the district level, an opportunity to work with you to resolve the difference and to get back into helping to get an IEP meeting so that you can discuss the services for your child.
So Paula, there was a comment, it sounds like there's a couple of people who agree, that legally the clock stopped when schools went offline. Would you say that's correct or incorrect?
I'm not sure that the clock stopped. Schools are still required to provide education. They're still required to provide free, appropriate public education, related services, designated instruction, all of the things that they were providing before. They still are required to provide all of that to students. So in terms of that, no, the clock hasn't stopped. It stopped for the assessment time, regarding assessment plans to be provided. It stopped for provision of school records within 5 days, and it stopped for records to be transferred from one district to another when a student transitions from one district to another. That timeline stopped. But in terms of actually providing an education to students, nothing has stopped there. There's still a requirement. There's still a requirement to hold IEP meetings. Okay. So right now, let's go to the next slide, and we're actually going to talk about Senate Bill 98. So this bill is one of the bills in California that impacts special education. So I think this kind of ties into the questions that were just being asked. So Senate Bill 98 is a trailer bill that was passed on June 29th of 2020, very recently. And this bill changed the number of instructional minutes that schools are required to provide to all students, not just those with IEPs or 504 plans. So districts are still required to provide 180 days of instruction per year to students. But during this school year, the 2021 school year, the number of instructional minutes has changed. So instructional minutes are provided on grade levels or by grade levels. So for kindergarten, kindergartners should receive 180 instructional minutes per day. First through third graders should receive 230 minutes of instruction per day. And fourth through 12th graders should receive 240 minutes of instruction per day. So that changed. They were receiving more education prior to the passage of this bill, or the requirement was greater, I should say, prior to the signing of this bill. And then if students return to school and we have on-campus instruction, then both the on-campus, and distance learning minutes can be included in those calculations. And during distance learning, of course, schools should be monitoring attendance, and also keep in regular communication with parents so that you can monitor, they can keep in abreast of how their student is doing. Okay, next slide. So Senate Bill 98 also made a change to IEP documents. So every IEP document now should contain an emergency plan. So what constitutes an emergency? Well, an emergency is, oh, I cannot think of the word right now, is triggered, for lack of a better word. It's triggered when education is not provided for more than 10 days. So because of an emergency, education cannot be provided for more than 10 days. That triggers an emergency. So under those conditions, the IEP team, the IEP, the Individualized Education Program Plan, should contain an emergency plan that outlines how the student will receive education during an emergency. And this plan now, this law was just passed on June 29th. So we want to get these plans into the IEP as soon as possible. So it should be written into the IEP at least by the next scheduled IEP that you have. So during that IEP, you should be discussing how services will be provided to the student, what are the goals that the student needs to be working toward, how will instruction be provided, related services, what related services are required, how will those services be delivered. If the student has an individual transition plan at age 16, that's mandatory. And if they do have that, then how will transition services be provided and what goals will be worked on during an emergency? So that now, with the passage of Senate Bill 98, those emergency plans should become a part of a student's IEP document. Okay, let's go to the next slide. So again, this is kind of a review, but we want to know in the emergency plan, how will related services and instruction how will that change as a result of having an emergency plan? Well, basically it's going to look like it does now. Right now, there really aren't emergency plans written into an IEP that tell us how related services or instruction should be provided. And that's partially what's caused a lot of the confusion right now as to how service will be delivered. But now in the emergency plan, we're going to know, are related services, so it won't be a surprise. Are they going to be provided virtually? Are they going to be provided through directly to the student, face-to-face? Is it going to be through telephone? Is it going to be provided on the computer? Or is assistive technology going to be provided in the home? And also too, we should know, does a family need technology in the home? Because when the students received on-campus instruction, any technology that they needed to access education in the classroom was provided in the classroom, right? And if assistive technology was required as part of the IEP, that assistive technology was made available to the student while they were at school and possibly even at home for homework use and extracurricular school activities. But now that students are working from home, technology, there's a very strong likelihood that technology is also now being required at home and families may not have access to that. So that will change. And so everybody's working very hard to make sure that technology is made available to parents at home so that students can access educational benefit. Yes.
A question actually from Maria about technology. So how do we best address the issue of a child not being able to utilize technology daily? Sounds like her child experiences increased aggressive behaviors during those virtual sessions.
Okay, so that would be something to work with your IEP team. This is where communication is really important. Call the person who is facilitating your IEP team, your IEP meetings. Also speak with the teacher. Let them know what is happening. Let them know that your child is experiencing behavioral challenges when you try to use assistive technology to access education. See if there's a different way. Brainstorm to see if there's a different way that education can be provided to that student. Maybe instruction to the parent, because that is available as a service in the IEP. So the parent may be able to receive instruction from a related service provider that they can then use to work with the child later at home. Maybe a behavior plan needs to be developed to help the child to work with some of the challenges related to technology. Maybe it needs to be broken down into really small steps, so that first the device is introduced, and then talk to the child and see if the child can express what they're feeling and their frustration and what they're concerned about. And then once you understand that concern, then maybe you can work with your school to address the concern that the child is experiencing or feeling or expressing related to the use of that technology. Okay. All right, so I'm going to go on here. Okay, and then so families may need help setting up technology. Those are some of the differences that may happen as a result of related services being offered through during emergencies or through an emergency plan. And the school may have, maybe there's somebody at the school, hopefully, that parents can reach out to. I talked to one parent, and she has several children, and they each are using 3 different platforms because the teachers are using different platforms. So can you imagine trying to be the home coach for all of that? So, you know, it's really helpful if schools can have somebody that parents can reach out to get instruction on how to use technology and how to use the platforms and how to even get on them with schools starting. So that students can, because the parent will then help the student to be able to get onto the platforms so they can receive education. And then sometimes, like we said before, maybe we need accommodations during distance learning, and we may need to turn off the camera. Maybe students are becoming very, very anxious, and that could actually trigger some behavior. If students are anxious because they don't want to be seen by other students, or there's too much stimulation when they see chat and they see other students and they see that what they're doing. So maybe the camera, maybe that's an accommodation that can be provided to the student, that they don't have to have the camera on during all instructional time. Okay, let's go to the next slide. Okay. So is the emergency plan only necessary during COVID-19? And the answer is no. It needs to be implemented anytime the school is closed for more than 10 days and the student cannot receive instruction for more than 10 days. So if there's a natural disaster like fire, like floods, like earthquakes, or another pandemic.
Paula, can you
yes.
I'm sorry. I was trying to change the slide and it wasn't allowing me to, and I stopped sharing. I guess I stopped sharing the screen.
Okay, yeah, I heard that. You want to go ahead and start sharing?
I'm trying. There we go. Let me just go to the slide that you were on, please. I'm so sorry.
Okay, okay. Can I go ahead?
Paula, while she's doing that, I'll
Sure.
catch you up with a couple questions. I'm going to take advantage of that time. So it seems like there were a couple questions about evaluations. And so given, you know, nobody's at schools, what is the evaluation process, timeline for that? Those are still available post 60 days. I hope Michelle and others, I'm asking the right question on your behalf.
So those are great questions, and we're going to talk about Senate Bill 117 in just a minute, and the impact that it has on assessment timelines. So I hope to be able to answer that question in just a minute. Is that okay? So we'll go ahead and move on with this, and then we'll talk about SB 117.
Great.
Okay, so let's go to the next slide. We're going to talk about who creates the emergency plan. Well, it's the IEP team. And of course, the parent is an integral part of that team, along with the district members of that team. And if the child is old enough to participate, the child, because, you know, the parent and the child know some of the challenges that they face with distance learning. They know the strengths of the child, and they know some of the things that need to be addressed. So an IEP meeting should not take place without a parent, of course. And then the district members of the team are also crucial to creating the emergency plan. And the district members of the team would include a district admin or somebody who would facilitate the meeting and who would also sign the document as the admin for that meeting. The general education teacher of the student, if the student receives general education, a special education teacher of the student, if the student receives special education services. I mean, not special education services, but specialized instruction in a special day class or in an SAI class, specialized academic instruction. Also too, let's see, any related service providers whose area will be discussed. If there is a transition specialist and you'll be discussing an individual transition plan, that person should be there. And any evaluators who have recently completed evaluations for the student. Those people should also be included in developing the emergency plan. The plan needs to, the parent needs to be able to sign the plan with informed consent before any of the services can be provided. Okay, next slide. We are at SB 117. So SB 117 was passed on March 17th, and it changed some of the special education timelines, and we've been referring to a few of those throughout this evening, but one of the timelines that changed was the need for assessment plans to be provided within 15 calendar days. So I'm going to back up and explain the assessment timeline very quickly so that for those people who might not be familiar with it, you can understand what the timeline should or was prior to the passage of Senate Bill 117. So what happened is that what happens is when parents request an assessment from the school district, they do it in writing, and then the district will have 15 calendar days to respond back to the parent with either yes, we're going to do it, and they would provide an assessment plan, or no, we're not going to, we don't agree, and we're not going to, and they provided the parent with a prior written notice that tells the parent why they're not going to do it and the steps they took to reach their decision and the legal support that they have for their decision. So and then from there, if the parent signed the plan, then within 60 days, the assessments were completed and an IEP meeting was scheduled. Well, what happened with Senate Bill 117, when that was passed, it waived the timeline for assessment plans to be provided to parents within 15 calendar days. So the timelines will resume. The timelines that have been waived by Senate Bill 117 will resume once in-person instruction begins and instruction is provided on campus. So for right now, the assessment timeline, so if a parent submits a request for an assessment, the district does not need to according to this California law, does not have to provide an assessment plan within 15 calendar days. They can, but they're not required to at this time. That's one of the special education timelines that was waived. Another timeline that was waived that is not special education necessarily, it's not special ed related necessarily, is if a parent requests school records, before in California, before the passage of Senate Bill 117, those records needed to be provided within 5 business days to parents prior to an IEP meeting, or just if a parent wanted to review those records. And that timeline has also been waived. So when school resumes, that timeline will go back into effect when school resumes in person. There is a federal law, the Family Educational Rights and Privacy Act, or FERPA. So it's Family Educational Rights and Privacy Act. That law provides that if parents request records, their child's school records, they need to receive them within 45 days. That law hasn't changed. That's a federal law, and that law hasn't changed. But the California law that provided for school records to be provided within 5 business days, that timeline has been waived. Also, the timeline, so if a student transfers from one district to another, before the passage of Senate Bill 117, the district that the student is transferring from needed to provide the district that the student is transferring to the students' records within 5 school days, but that timeline has also been waived. And another thing that has been waived with Senate Bill 117 is that for uniform complaints that are filed with the California Department of Education, the 60-day timeline for the California Department of Education to investigate complaints that it receives, that has been waived, and that timeline will again resume when when education is provided in person. So those are some of the changes. So if you have requested an assessment and you've already received an assessment plan, then everything remains the same. The 60-day timeline is still in place. If the district gave you an assessment plan and you signed it and you sent it back to the district, then the district should complete assessments within the 60 calendar days. And those calendar days include weekends and holidays that are no more than 5 days long. And then an IEP meeting should be scheduled within that 60 days to be able to discuss the results and then to provide services based on the outcome of the assessments.
Paula, what about incident reports and complaints?
If those are provided, so incident reports are typically provided by schools. So the only thing that changed are complaints filed with the California Department of Education. If they are school-related concerns or complaints, then nothing has changed with that. They still need to provide the incident reports to the parent. They just, well, wait a minute. Let me think that. No, because school records, if that's part of the school records, right? Yeah, I'm sorry, my brain was on a different, I was thinking California. No, I was thinking of the uniform. I was back on California Department of Ed and uniform compliance complaints, but no, these are school records that we're requesting. And so that timeline has been waived at this point because it's part of the child's school records.
Now, a couple more questions. Since the 15-day assessment timeline is in the IDA, doesn't that stay in place since it's federal law? Or like Andres is saying, are we just, at the mercy of the pandemic? Isn't there anything to hold the districts accountable?
So that's a really good question. And so let me see if I can explain that. So within the federal law, every state needs to follow the federal law. And I want to emphasize the things that have changed are California law only. The federal law, the Individuals with Disabilities Education Act, that is still, we have to implement everything that's in the federal law. Nothing changed there. It's only California law. So the idea, the Individuals with Disabilities Education Act is the federal law that governs special education. And it provides, it provides that IEP meetings have to be held within 30 days of students being found eligible for special education. And it says that the initial assessments need to be completed within 60 days. But I don't remember reading anywhere where the idea, the federal law provides for specific timelines, like a 15-day timeline that the district needs to be able to respond to parents. So each state has to follow federal law, but then they can also write their own laws and regulations to address areas that support and implement the federal law. And so California has written some education code that addresses timelines that helps. Actually, we have a pretty, I've read some other states' timelines for assessments, and we have a pretty good timeline when we can implement it. But California has chosen to write a timeline and requiring districts to respond to parents within a time frame, and then parents to respond to the district within a time frame, and then assessments to be completed within the federal guidelines, which is 60 calendar days. So I hope that answers the question. The state is the one who put the timelines into their education code. It's not a provision of the IDEA.
So just for clarification, if a parent signed for evaluations before the school closure, those evaluations should have still taken place, correct? Or no?
Yes, so if the parent submitted a request prior to the signing, it actually isn't it isn't even related to school closures, the day of school closures. It's related to SB 117 that was passed on March 17th. So if you submitted an assessment request prior to March 17th, then yeah, the district needed to provide you with an assessment plan within 15 calendar days. But as of March 17th, that timeline was waived.
Okay, thank you, Paula.
Yes. Okay, so now I'd like to turn Susie, my co-presenter and my colleague, is going to present the remainder of the slides. So Susie?
Thank you so much, Paula. So now we're going to talk about what education will look like when students start school in the 2020-2021 school year. I do have my camera off because I am very anxious right now, so I apologize for that, but I'm going to try to present as best as possible. My computer is not allowing me to change the slide. Okay, here we go. So, so on Friday, July 17, 2020, the governor announced new guidance for schools.
Susie, sorry to interrupt. If there's any way you could just get a little closer to the mic. We're just having a slight hard time hearing you.
Let me
Boy, I know you're going to do as best as you can, so appreciate it.
Let me see if the volume, can you hear me now?
It's about the same.
If you speak up a little bit, Susie, can you speak up? Okay.
Sure, I'll do my best.
Thank you, Susie.
Thank you.
Okay, I think. So on Friday, July 17, 2020, the governor announced new guidance for when schools can reopen for in-person instruction. So both public and private schools will not be allowed to bring students and staff back into campuses if they are in the counties that are on the state's monitoring list. This monitoring list tracks coronavirus metrics. So currently right now, 32 out of the 58 counties in the state are on the list, including Los Angeles County, Orange County, Riverside, San Diego, and San Diego counties, as well as Sacramento and the Bay Area counties. However, he also stated that schools in counties that he stated that schools in counties that are on the list can reopen after the counties have been removed from the list for 14 consecutive days, as long as they have followed the health and safety guidance from the California Department of Public Health. So when the schools reopen for in-person instruction, all staff, students in grades third grade to 12, they must wear masks. And students in second grade and under, they will be encouraged to wear the mask. So these rules are already set, and schools and counties can also open if the districts apply for waivers that allow elementary schools to reopen for in-person instruction, even if they are in the counties are in the monitoring list. So it's important for the districts to follow instructions from the Department of Health, Public Health, in order to be able to reopen if they're in the list of those counties that schools are not able to open. it's important for parents to check with your school district to see how the school is going to reopen, what type of, if they're able to reopen, and how they're going to provide the education. So here are some of the model options for the upcoming school year. So it's important for parents to find out in the district, your district, what type of model they're going to use. So here, these are some of the models, but not all of them. So maybe your district might be implementing a different model. So the first example is the 2-day rotation blend learning model, where the school district will choose 2 days. It could be Monday and Wednesday, and then they're going to choose what grades are going to go on those 2 days. It could be kinder to 3rd grade. They're going to go on Monday and Wednesdays, and then 4th to 6th grade, they're going to go on Tuesday and Thursday. Now, all on the days that the students are not going to school, they will be provided with some work that they can do at home. And on Fridays, all students were engaged in the distance learning. So while the students are not in the school, whether it's Monday and Wednesday or Tuesday or Thursday, students can engage in enrichment opportunities aligned with their academic goals and the days when they are not receiving instructions. The second learning model is the A and B week blended learning. So in this model, half of the students will attend for 4 days in the school, and the other half will engage in distant learning. So if a student, and then they're gonna alternate during the week, and this will be all grade band. So the district will choose what grades will attend first, and then the second, and then when they're gonna alternate. The district should have sent you a letter to also let you know what model they're going to be using. If you haven't received one, you can call your school district to get that information. So these are other examples. The looping structure, this is for schools serving grades levels TK through 8th grade. Students stay with the same teacher and same group in cohorts for multiple grade levels. So for example, it could be grades 1, 1st grade and 2nd grade, or 3rd grade and 4th grade, and so on. So it's important for students to stay connected with the teachers and also the students. So this will help them to be able to have a closer friendship, get to know each other. So that's why it's specifically for students that are in elementary schools. It's important for them to have a good connection with their teacher and also with other students. Now, the early and late staggered schedules, for example, it could be different grade level bands. They would start and will be dismissed at times. They can have a group of students will be in the morning, and then another group will be in the afternoon, and they can rotate. So if this is one of the structures that the school district is going to use, then if you have any questions, you can also call the district and have them explain to you how they're going to go about it. So in this schedule, the school bell will accommodate. So there's gonna be multiple recess and lunch periods, and times for students to engage in hand washing. So that in order for them to be able to continue for the day in the school. So if the school bell is what's gonna determine, okay, now the AM kids are gonna go to recess or lunch, and or when they're going to start in the classroom. So when students return to school, the districts should consider how they're going to engage families and provide activities so that they can feel comfortable in the school campus again. So we know that the COVID-19 pandemic has created a different types of traumatic experiences and high levels of stress, not only for the students, but for the staff also, and the families also. So before the school starts, schools need to determine, or districts should need to determine how they're going to engage the families to provide them activities to help families feel comfortable in school. And also for staff, the school districts can determine how they're going to help the staff feel comfortable once they come back to school, and what type of professional development will be offered for teachers and staff, and how often it's going to be available. Districts should also, or can also consider how staff will provide non-academic focused check-ins with students, and what types of trainings can the district provide to help students learn ways to express their feelings related to wearing masks. So the district can provide social distance activities so that students feel comfortable while they're at school, but at the same time learning how they can protect themselves and also express their feelings while they come back to school. Districts can also decide on how they're going to handle student and families' understanding of physical distance measures, and how the students who need additional support to physically distance, or how they're going to be able to wear a mask due to the manifestation of the disability. So if they're not able to wear it, then the school can provide support and information and ways to help the student understand or protect them so that they're safe in the school.
Susie,
yes.
May I ask a question, and maybe you'll address this in the next slide. But there was a question about protocols for school when they think a child might have COVID. You know, we've heard some things on social media that the child wouldn't be sent to the parents, but instead to a testing center. Are you aware of any protocols?
They should be monitoring the students and staff to see if anybody, whether it's a student or staff, has symptoms, and they should be checking temperatures. So if the student starts having these symptoms, then they should contact the parent immediately, and that way parent can pick up the child. I don't know if there's any additional information regarding that, Paula.
Yeah, no, I think that's a really good answer. I don't know that there's any particular protocol. I would suggest, you know, that parents contact your individual schools to find out what the protocol is within your school, because I think that's kind of a district to district or even school to school decision that's being made. So they will have the best and most up-to-date information.
Thank you, Paula. So yeah, like this right here, where so the district must consider the health and safety needs of the students and the school personnel. So of course, anytime, whether it's school personnel or students, like I said, are showing any symptoms, immediately they should contact the school, and the school should contact the parents. That's the most important thing, to make sure that the school maintains that safety needs of all students. Also, the school can consider how they're going to maintain a supply of personal protective equipment and essential protective gear for students that need or that require medical procedures like toileting, lifting, and mobility assistance. Of course, the staff should have all the protective equipment they need in order to be able to have a safety environment for these students that require medical procedures. Also, this district can consider how the district will address students with disabilities who refuse to wear the mask. So the district should have a protocol on how they're going to deal with these situations. And also plan for students who are medically fragile and they're immune compromised. They need to define how the staff can honor physical distance, and also make recommendations to the staff in order for them to provide the needs that these students need. Also, they need to determine how adequate space and facilities will be utilized to maintain health and safety of students and staff tending to individual students' medical or personal needs. So the district will have and will determine how they're going to do this and provide this information not only to the staff but to the student's family also. And also build in flexibilities to keep students connected and included in the classroom and school community. So the district needs to provide these accommodations and considerations for students with disabilities.
Susie, is there any thoughts about when parents are immunocompromised?
I'm sorry?
Is there any thoughts about when parents are immunocompromised?
I don't have an answer for that. We can find out. In school districts should be able to provide that information also. So if that's something that needs to be considered, definitely contact your district.
And also to the, I'm thinking maybe the CDC, maybe their website has something, or the California Department of Public Health can provide some guidelines. So that's something beyond the scope of our expertise.
Okay, and we can provide you with the link for this. Anna, can you provide this on chat, please, the link?
Oh, to the California Department of Public Health?
Yes.
That link, okay.
Thank you. So once students return to school, school districts should also consider any special or unique needs for students with disabilities related to plan, district or school-wide procedures and protocols related to the following. Daily health screenings and temperature checks. So the school needs to determine how they're going to do this, when they're going to do it, and how often. Restroom use, as well as diapering and toileting. Paths of travel, use of campuses for recess and recreational activities. All of these things should be in the IEP document also, in order to be able to follow these directions. And for the students that have these unique needs.
Susie? Susie, I'm not sure that those would be written. They're not necessarily a service. So this is something that the school can consider.
Okay. Thank you for that, Paula.
Okay.
So the school district also must make sure that that the students are receiving their services and related services, and also be educated in the least restrictive environment. Also determine how the district will provide any services that were provided before the schools were closed. If it's in the IEP, the school district should consider it and let the parents know how they're going to provide these services. And also discuss how staff and providers will conduct assessments while practicing physical distance. So far we talked a lot about, how the school district and the parents can collaborate together. And Paula explained a very, she was very explicit on how important it is for parents and school districts communicate openly and often. This is key for students to receive an appropriate education and also services that they need. If parents are not communicating with the district, then the district will not know what, what's going on. So it's important for parents to either communicate via email or letter writing. If you don't get a response from the district, it's important for you to do follow-up letters in order for you to be able to get an answer to your questions or concerns. Don't be afraid to initiate conversations to resolve concerns. Take the initiative. It's important for parents to understand that you are a huge part of your child's education plan. So in order for you to be able to help your child be successful, it's important for parents to take the initiative to contact the school district and inform them any changes, whether it's good or bad. It's good. It's important for parents now and during this time for parents to communicate what's working for your child or what's not working for your child. Write things down. Make sure that you're communicating any changes in your child to the district, to the IEP team. Like I said, you can try multiple ways to communicate. It's important to do everything in writing, especially if you're communicating a concern. Make sure you do it in writing. As long as parents and teachers or schools are working together, the child will be able to receive a free, appropriate public education. Remember, this is a tough time, not just for students, not just for parents, but for teachers also. And they're doing their best. They're going to do the best possible to be able to collaborate with parents. So be professional, be friendly, and be kind. Put yourself in their shoes. They also have a lot of concerns about how they're going to teach now. How are they going to be able to help the students and be able to keep their masks on? It's so many things. There's so many things to consider, and so many things that bring a lot of anxiety to parents, students, and teachers. So if you have any concerns, make sure that you're communicating them. And once the schools reopen, well, it's very important to continue that communication in writing. And if you receive a phone call, make sure you respond in writing so that you have that conversation logged in writing.
Susie, can I add something? Can
Sure.
I add something here about, so, the written word is, we need to be, we need to make sure that when we're writing in a respectful tone, and also, for everybody involved, that communication is respectful and that it's coming from a position of fact and not a position of emotion. So for me, when it involves your child, it's so easy to talk to another parent and help them, to write a nice, calm letter. But when your emotions are involved, it's a completely different thing when it's your child, right? So it's really important to make sure that you whether it's the school or the parent, give yourself space and give yourself time to be able to write from a position of fact before you put it on paper. And if you do have emotion involved, you might want to have somebody review that written communication to make sure that the actual message is going to get delivered, not the emotion. Because I don't know about other people, but if I receive a really heavy duty message with a lot of emotion, negative emotion, or maybe not negative, but real out there type of emotion involved, maybe some anger involved, then that triggers emotion in me, and I'm not able to deal with maybe the situation in a way that I might not have had the communication been written in a respectful way. So keep that in mind when you're putting stuff on paper, that you need to do it when you're not in an emotional place, and you need to write with factual information, not emotional information.
Absolutely right, Paula. I've had parents email me the letter before they send it to the district too. So if that's the way that we can collaborate or help you, then you can contact our offices, and we can all definitely look at the email or letter that you're going to send out before And that way, you know, sometimes we think we're being calm and we think we're being patient, but sometimes like Paula said, emotions come out, and we definitely want to collaborate with the district. We want to make sure that they see that we understand that they're, you know, they have fears, they have, you know, they have concerns too. So we want to make sure that we are being in a, like I said, professional and kind, so that way we can have a good response. We want the best for our kids, and the only way to have a good relationship with the district is by communicating and being open about whatever fears we have, any concerns that we have. Remember, they can't read our minds, so it's important for us to communicate these fears or concerns that we have, or if they need, if your child needs any assessments, or make sure that you are writing letters. If the child needs, you know, if you're struggling during this time, make sure that you are communicating this to the IEP team. Any other questions?
I just wanted to acknowledge a couple comments. Parents of children with autism and ADHD, you know, how do they replace a special ed teacher? You know, when having these kiddos sit in front of a Zoom, they're not able to pay attention. So I just wanted to, there's no real question there, unless you have any answers, please. But I just want to acknowledge those comments.
Right. So you know, it's important to, like I said earlier, it's important to communicate these issues, and it as soon as possible. Let the IEP team know that this is happening. Make sure that that if ask them what other options they have, if there's any other options that they can have, because right now everybody's trying to provide the best services as possible, education, you know, so maybe, you know, if you can come up also with any suggestions, share those with the IEP team and see if there's anything that they can change or they can do. Anything else you want to add, Paula?
No, I think we, you know, we talked about some of those things before. I don't know, like small group, perhaps. I know some schools, again, this is an individual thing, but some schools are providing very small group instruction to children who are students who are experiencing a great deal of difficulty with virtual learning. Again, maybe some more behavioral support, maybe some counseling. I don't know. There's so many different things that IEP teams can consider to be written into the plan. And again, it's an individualized education program, right? So each of our students are going to respond differently. So like Susie said, that open communication with your school district is so important, or with your IEP team. Let them know of the struggles, and so that they can work with you to help your student. And I know that we don't have all the answers here, and that's why we keep saying, you know, reach out to your school district, reach out to your school, your IEP team. They are the educators, but you are an integral part of that education and of that IEP program and that team. So you need to be a part of that, and by communicating with them, with the district members of your team, I think you know, you can have a better outcome for your student. And then the other thing, like Susie was mentioning, put yourself in the other person's shoes. If you're not sure what to do, understand that maybe they're not sure either at this time, because this is a whole new learning experience for districts as well as it is for parents. So, so in all cases, it gives a different perspective if you think of it from the other person's perspective. But in terms of trying to find an appropriate program, I think that's something that the parents and the schools work out together. I don't have a perfect answer, like if you do this, then, you know, it's going to work. So I think we're all experimenting and trying different things depending on the individual students.
Now, talking about different things, and Paula and Susie, in the absence of one-on-ones, is there any education for parents so they can be equipped to help their children? And if there is, can the cost of those classes be compensated?
Well, parent instruction is a part of, can be a part of the IEP. But it's usually that instruction is provided by the school or the school district. So if something is required or requested that's going to cost money, again, then that would have to be discussed by the IEP team to determine if that type of expenditure is going, if like a non-public agency or a service provider like that is going to be written into the IEP. But parents could meet with their IEP team to see if they can receive instruction from the school so that they can work with their child at home.
Thank you.
Yeah, and it could be through Zoom that they receive this. So parents need to get creative and while requesting this with the school district. So that's something once you contact the IEP team and request this as a service, then the district, maybe you could request somebody from the district to provide this training via Zoom. And, because of course, right now they're not going to do it in person. So maybe suggesting that to the IEP team, that would be a good idea also. So remember,
I noticed that we've gone quite a bit over time, and I appreciate everybody's patience in working with us as we answer the questions. Susie, did you have any more thoughts that you want to share before we close?
So I just want to thank everybody. We had a really good group today. Thank you so much for attending this workshop. We hope that you received information that you could use in order to help your child start the new year, school year on the right, on the right path. And anything that we can do, you can contact us via email or call us. We would really appreciate it if you can complete the evaluation. And the link is on the screen right now. And also the QR code, if you hold your phone, you use your phone camera, you can hold it and it'll bring you up to the link on the QR code on the screen. And if you could please fill out the survey, we would really appreciate it so that we can continue to better our presentations or workshops. So that we can, any suggestions you can give us, we would really appreciate them. Thank you so much.
And if for some reason you cannot activate the link, if you can copy and paste it into a URL, I think you might be able to access it that way. It's a real short survey, so we appreciate you taking the time to do that. Like Susie said, it helps us to show our grantors that we're doing the job that they're asking us to do, but also it helps us to improve our services or to continue doing what is working right now. And your responses help us to know that. If you see a question that doesn't apply to you, please put NA by it. Or as your response for that, rather than giving a real low mark, because if it doesn't apply, then it doesn't apply to you, and that's okay. But I want to join Susie and Rebecca in thanking you all for joining us this evening for navigating distance learning during COVID-19, and we hope that we'll see you again on the 20th and the 27th for our upcoming webinars in this series.